I can start now, right? Good morning, everyone. Welcome back. I know we were here just last month, but it's great to virtually see everyone again. Before we start, just a few housekeeping reminders for the virtual environment. Please mute your mic unless you are speaking. Please do not use the chat function for side conversation, as this is a public meeting and all comments should be in public. But it has been helpful to use the chat function if you have a question or comment that you'd like to make so we can keep it orderly. Please introduce yourself for the record before you speak. We've got another packed agenda, as we always do. We're here again, as you know, because we need to go through the audit results. So Lawrence Fernstall will be joined by KPMG to go over the audited FY20 financial statements, resolution to approve the external audit. Mr. Fernstall will also go over FY21 first quarter financial results. We'll have a faculty center report from Dr. Karen Eden and an annual integrity report from Tim Marshall. As the country starts seeing a third wave of COVID-19 cases, we are also very interested in hearing from Dr. Peter Graven. He's been monitoring and modeling COVID-19 cases from the very beginning, and he'll share the latest data and his thoughts on what it means to OHSU and our state. And we have Dr. John Hunter, CEO of OHSU Health, and Dr. Derek DeVivier, Senior Vice President of Diversity, Equity, Inclusion, here for our recurring update on anti-racism efforts in the university community and the drive to instill a culture of inclusion. I also know the board is eager to get an update on OHSU 2025, the strategic plan that's been developed by Dr. Jacobs and the leadership team through crowdsourcing and a lot of input from the university community. As mentioned at the last meeting, we hope to have it on the agenda item this month. But given all the things that are going on and the things we need to discuss here today, I believe Dr. Jacobs will be giving a status update in his opening remarks, and we'll look to have a more robust view, hopefully at the January board meeting. I'd like to acknowledge Dr. Jacobs for a recent editorial he had published in the New England Journal of Medicine, calling for the elimination of disparities in healthcare related to the treatment of appendicitis. I applaud Dr. Jacobs for his commitment to health equity and thank him for speaking out on this important topic. Before turning it over to Dr. Jacobs, I'd like to share some sad news that we learned this week. Former OHSU President Len Laster has died. He served from 1978 to 1987. He was integral to the development of the Ballum Institute. On behalf of the board, we send our sincere condolences to the family and friends of Dr. Laster. At this time, I'll turn it over to Dr. Jacobs for his opening remarks. Thank you.
Thank you, Mr. Humphreys. Good morning, everyone. I'm pleased to have the opportunity to give this update. First, you may have seen or heard that Provost Elena Andresen has announced her intention to retire at the end of this academic year. Among many other contributions, Dr. Andresen was instrumental in helping the OHSU-PSU School of Public Health secure accreditation, and also led the charge to grow our OHSU rural campus programs. We very much appreciate all she has done for our education mission, and we wish her all the best in retirement. And we'll be conducting a national search for her replacement. Moving on, Dr. Eric Guaye, a structural biologist in our Ballum Institute, is one of only 100 newly elected members to the prestigious National Academy of Medicine. His contributions to neuroscience research have had a profound impact on our understanding of the brain structure and function. And so we're proud to have him pursuing this groundbreaking work at OHSU. Phil Knight recently accepted the 2020 Champions for Cures Award from the Association of American Cancer Institutes. In his video acceptance message, Mr. Knight said, quote, "Cancer is not like polio. They'll be cured with a single vaccine. It'll be cured brick by brick over a long period of time. But I sincerely believe Brian Drucker and his team at OHSU will be one of those bricks, and Penny and I cannot have a bigger legacy than that," close quote. So we congratulate the Knights on receiving this wonderful award and thank them for their partnership. Also in the research arena, Samuel Sang and Aurora Blucher received one of two 2020 Circle of Giving grants for $125,000 to support their research that aims to increase understanding of the resistance in HER2 positive breast cancers. The other grant went to Martin Kelly and Oline Roneliev for research related to Alzheimer's disease in women. Some studies have shown a link in women between the disease, between Alzheimer's disease and lower levels of the female hormone estrogen. But hormone replacement therapies are also associated with an increased risk of cancer and blood clotting. So doctors Kelly and Roneliev have developed an estrogenic compound, they call it STX, that targets the brain but doesn't cause side effects in other body systems. So this is very promising work, both of those examples. The Knight Cancer Institute's Community Partnership Program has temporarily shifted its focus from cancer to COVID-19 and awarded more than $200,000 to 14 COVID-19 related community projects around the state. These projects address things like food insecurity, COVID-19 outreach, and enhancing technology to promote social distancing guidelines and more. On that front, with generous help from some of our donors and great work from our team members, OHSU has expanded its COVID-19 testing laboratory, and on October 7th processed its 100,000th test, with now a capacity for 3,000 tests a day. We believe that this new laboratory is the most robust in the Portland metro area, but work continues. Shifting on to OHSU Health in particular, OHSU Health, along with its partner hospitals, serve 40,000 Oregon Health Plan members through the Health Share of Oregon, a coordinated care organization, or CCO. As you may be aware, CCOs are Oregon's mechanism for providing health care for those who are on Medicaid. Health Share recently audited our OHSU Health Services Group. The audit was part of a regular process to determine compliance with federal and state standards relating to Oregon Health Plan members in the areas of access, structure, and operations, quality measurement and improvement. And our results were very strong, with multiple areas scoring 100%. So we'd like to thank the entire team for their work to provide whole person care for our Oregon Health Plan members. As Ms. Munfree said, I'm going to give a brief report on OHSU 2025. We've included the priorities for OHSU 2025 as they currently exist in the board packet. But due to the unforeseen challenges we are facing this year, and I'd highlight some of the financial challenges, we felt the need to review our initiatives and reprioritize them, as is part and parcel of every living, breathing strategic plan. So this reprioritization should take into consideration and will take into consideration funds that are available, possible revenue generation, and any interdependencies with our University Improvement Project, OHSU Accelerate, as well as our efforts around anti-racism and cultural inclusion. The task is to review the original prioritized initiatives and ask the question, which need to continue, if any, what can be expanded or should be expanded, what should be reassessed, deferred, canceled, or are there new initiatives that we should consider as regards the near term? So we are creating a study group, and that group is going to assess what was previously adopted and currently implemented, and then provide draft modifications by the middle of November to the mission councils. Remember, we had set up mission councils to help with this strategic work, including research, education, patient care, as well as data management, key performance metrics. And so we will be presenting those modifications to the mission councils for them to consider. And then we will ask those leaders to modify the tactics that were originally identified in OHSU 25 to address COVID-19, the impact of COVID-19, as well as other stressors, and then develop new assumptions as appropriate. We expect that process to begin the week of October 19th, and we expect it to conclude almost in its entirety by early January 2021, giving us an opportunity to provide a detailed presentation to the board at the January meeting. There is a great appreciation for the hard work that everyone is doing and all the things they're doing simultaneously. But we believe in our people's ability to be able to add this important work to their plates that are already full. And furthermore, we believe this activity can help us be more granular and deliberate as regards other initiatives, another opportunity to be even more focused. So we want to thank them, thank everyone for their dedication to OHSU, and thank the board for their support and continued commitment to help us do the hard work needed to keep us moving closer to our timeless aspirations. With that, I'd like to turn it back over to Ms. Monfries for the rest of the meeting.
Thank you, Dr. Jacobs, for that report, a robust report that you did. The board members have the minutes from our meeting on September 25th in their materials. We will take a vote to approve those minutes. Ms. Seeley, can you call the roll? Oh, can I have a motion to accept and a second?
So moved.
Second, Ruth Beyer.
Who made the motion?
I did, Danny.
Any questions? Ms. Seeley, you can call the roll.
Director Tyson.
Aye.
Director Paulson.
Yay.
President Jacobs.
Yay.
Director Kahn.
Yay.
Director Dubé.
Yay.
Director Beyer.
Aye.
Director Chamberlain.
Yes.
Director Zika.
Yay.
And Chair Monfries.
Yay.
It passes.
Thank you. We'll now turn the meeting over to Lawrence Fernstow and KPMG to review the external audit of FY20 financial statements. Mr. Fernstow.
Thank you, Chair Monfries. Next slide, please. Next slide. Let me give a brief introduction to the audited financial statements before asking Drew Corrigan and Sarah Oper of KPMG to give their report to the board. As the chair noted, one purpose of convening so soon after last month's meeting is to receive the report of our independent auditors, KPMG, on last year's financial statements. They also met with the Finance and Audit Committee to review their findings on October 16th. As audit partner Corrigan will report in a few minutes, the audit went well with a clean opinion and was completed virtually due to COVID-19. Due to required disclosures under government accounting standards, what we lovingly call GASB, the audited financial statements now run fully to 116 pages. However, for new readers of them, the first 32 pages provide a required management discussion and analysis, an MD&A, of our financial activities with prior year comparisons. And in particular, I would draw people's attention to pages 3 through 5, which provide a financial highlights. There are many schedules throughout the 116 pages. The 3 pages at the very end are probably the most helpful because they show OHSU results both prior to and then after consolidation with the OHSU Foundation, which, as you know, manages the endowment and raises funds for the university. Next slide. The audited FY20 results are the same as the unaudited report I gave to the board in September. In particular, consolidated net worth fell by $14 million during the year from $3.619 billion at the beginning of the year to $3.605 billion at the end. This compares to an increase of about 252 million in the prior year and an average annual increase of 214 million of the prior 9 years. So roughly speaking, $200 to $250 million swing from where we were before. GAAP reporting on a consolidated basis with the foundation and including pension and other adjustments is pretty complicated. I've tried to simplify that in a table here, which is also included in page 3 through 5 financial highlights section of the audited statements themselves. That reconciles the board report of operating income to that shown on the consolidated operating statements. So we report a $28 million operating income loss for fiscal year 20 for OHSU. The main thing not in there this year is moving the PERS pension expense from a required cash contribution to a full accrual basis, what we call GASB 68 basis. And that was a significantly large accrual this year because of the multi-year impact of the PERS board reducing the rate of return assumption on it. So that was a $59 million accrual. So that results in a total university operating income loss of $87 million. And if one were to look at the consolidating table at the very last page, page 116 of the audit statements, one would see that in the middle of the table. Then we do 3 additional adjustments. We consolidate the foundation operating income. We make a minor elimination of capital contributions from the foundation. And finally, under GASB accounting, the state appropriation is considered a non-operating item. So we reclass that below the line. So in the front part of the financial statements, the consolidated operating income would be is shown as a loss of 186, again about 232 million down from last year. From that loss is then offset by investment income at 83 million, the reclass state appropriations, 38 million of CARES Act support also booked as non-operating income under GASB accounting, and 11 million of other miscellaneous items, and that yields the $14 million decline in net worth. One more page, I'd like to make just 3 more comments. Next page, please. The main driver of the large pension accrual this year was, as I noted, the decrease in expected PERS investment returns from 7.5% to 7.2%. Our share of the unfunded PERS liability is now $504 million, up about $50 million from last year, and now about half the scale of our $1 billion in long-term debt. Unlike private or FASB accounting, under GASB accounting, pension obligations are discounted to present value by the expected rate of return, that's 7.2%. If, for example, the discount rate had been lowered by 1%, this is a table included in the disclosures, say from 7.2 to 6.2, the unfunded liability would increase by $300 million. So you can see it's very sensitive to that number. The foundation, as I noted on the previous page, had an operating loss of $64 million. This is not as alarming as it seems. There are 2 normal reasons for this. One is that it transferred more gifts up to the university from prior year pledges than it received in new commitments. That's not at all surprising because remember, we had booked in prior years the gifts, including Phil and Penny Knight's $500 million matching gift for the Night Cancer Challenge, and now we're spending that money, deploying it for the program. So it was a bump up in prior years and is now being transferred up to the university. And then secondly, on an ongoing basis, some of the transfers to the university and operating expenses at the foundation are funded by investment return on the endowment. That's a good thing, not a bad thing, and that's reported as non-operating income. And finally, as I noted, under GASB, state appropriations, even though they support normal operating expenses and program expenses such as education, are reported below the line of operating income rather than within operating. So with that, if you could turn to the next page, let me invite Drew Corrigan to give the report of KPMG.
Thank you, Lawrence. Good morning, board members and other folks on the meeting here today. Thank you for the opportunity to present the results of the 2020 financial statement audit for OHSU. Maybe we could advance to one slide. We have a brief agenda here for you to cover some of the key aspects of this year's audit. And as mentioned by Lawrence, we did have the opportunity on the 16th of this month to meet with your Finance and Audit Committee, where we did a fairly deep dive on the financial statements, some of the unique items covered for this year, and also our required communications, but we'll also highlight those for the board as well. Next slide, please. Maybe to just give the overall context a little bit here, the financial statements for the consolidated enterprise of Oregon Health and Science University is the topic for today. There are a number of audits consistent with what the audit plan would have been that go to support that overall financial statement opinion. I met with the Oregon Health and Science University Foundation and Dornbecker Foundation boards earlier this week. We issued those reports yesterday. And again, you see the laundry list of the various audits that take place here. And the one I'll come back to towards the end of the presentation, a little bit about some uniquenesses in the world of COVID-19. The fourth bullet, the OMB Uniform Guidance Single Audit, that's the audit over the compliance with the requirements of the federal grant programs that the university is a party to. That traditionally has been focused around research and development and student financial aid. But as Lawrence mentioned, there are $38 million of CARES Act funds that came to OHSU in the current fiscal year. Those have come in a form of a federal grant as well, and those will be subject to the single audit too. And actually the rules, maybe just to fast forward a little bit on that, the rules around those audit requirements have not actually been published by the federal government yet. So management is waiting to see those, as are we, to work through that aspect of the audit reports for the year. So that's one nuance, given the world we're living in right now, that we're all working through together. But we have confidence that the requirements will be understood. We'll work through them, and the management team will support that process. So that's to come, and we can report back when that work was complete. But all the rest of the items on this page are done or are ready to be issued in conjunction with these consolidated financial statements. The last item, Sarah Opper also is on the line here with me today. She's a managing director in our Portland office too, that helps with overall OHSU audit, but also leads the Tuality financial statement audit, which has been completed and issued as well. And you may have noticed in that 116-page document, there are a few pages in there devoted to the Tuality financial statements. Next page, please, is the next two slides are the snapshot of our team that does the audit work for OHSU. Yes, you have a large organization administratively that supports the finance function. We have a pretty good number of people on our squad that works through the audit process with Lawrence and Sandy and their teams across the organization, with Diana and the hospital. And these are the folks that are the leaders of that effort. We do have certain specialists that help us with certain aspects of the non-accounting parts of the audit. Maybe one person to highlight, Chris Ray, is our quality control partner. He is a new participant on our team this year. We do have rotation requirements, and just so you all know, there are some fresh sets of eyes that get involved and kind of look over what Sarah and I are leading on an annual basis too, to make sure they're agreeing with the key conclusions we've reached in the audit. So again, maybe we'll advance two slides, but the following slide is really the team for the foundation. So we can probably move on to the next one. So as Lawrence also mentioned, our opinion is a clean or unmodified opinion. That's true for all of the audits that we have or will be issuing here for OHSU. It's the best kind of audit opinion we can issue. It indicates that we believe that the financial statements are materially correct as presented, which also includes the footnote disclosures as well. So that's the overall aspect of the end result there. Next slide, please. This is a summary, and I'm not going to go down the list here, but there are many differences between GASB financial reporting and FASB, which is, again, maybe where some of you all might traditionally see in the for-profit world. But because of OHSU's connectivity and roll up into the state of Oregon, we follow the GASB model. And I think Lawrence did a nice job of highlighting the key differences. But again, the new item for this year was the CARES Act money. GASB was very prescriptive in releasing guidance that needed to be treated the same way as appropriations do for financial reporting, which again, for our peers in the market here, FASB reporting entities would have likely put that in their other operating revenue category. So that is an unfortunate difference between FASB and GASB. It'd be nice if the world was a little more aligned there, but that is proper accounting from our auditor standpoint. Okay, the next slide, a couple of the next slides actually get into our required communications as your external auditor. The first item here is responsibilities under generally accepted auditing standards. If there were any material errors, illegal acts, things of that nature, clearly we have a responsibility to communicate that to the board through the Finance and Audit Committee. Nothing to report in that realm at all. We again would not be probably issuing unmodified opinions if there are significant matters in that category. So again, that's the end result. We've got the right and the good kind of audit opinion. And as Lawrence also mentioned too, the financial statements that you have in your proposed final financials here are the same as those that we started with in the audit process. There were no audit adjustments that needed to be recorded or even passed on during the current year in terms of the end result there. So that was a good outcome, and we can go to the next slide. Disagreements with management, if we had those in relation to the financial statement audit, we have a responsibility to share that with the group. And this would cover either accounting matters or even just audit process if we had any scope limitations, things of that nature. It goes without saying, but I'm going to go on record. We get great support from the OHSU team. It's a collaborative effort. Certainly, throughout the year, we have a lot of good interaction with management, which is what really gets us to the point of being able to audit at year end and not result in audit entries and things of that nature, because the more important items have really been addressed in the planning and the coordination that we have with Lawrence's team throughout the year. So we really appreciate that approach to the audit process. Next slide, please. Just a couple things I want to highlight on this slide. Because we did not have any significant audit entries, we certainly are looking at internal control as part of our audit as well. If we had any matters that either rose to a significant deficiency or material weakness on the control side, we'd be reporting that, and there were no such matters in the 2020 audit. And then also, we need to be able to assert this before we start, and also when we're issuing our opinions, that KPMG is in fact independent of OHSU and all of the different entities in the structure. And there aren't any other services or relationships we have that we believe could bear on our independence as well. So again, that's a key aspect of what we do as your independent auditor. Need to be able to assert that to the team here. Next slide, please. The non-routine transaction. I think we've talked a little bit about the CARES Act dollars and just things with the overall funding that has been provided. And I think maybe if we go to the next slide, I think is two slides up. I'd like to actually hit on this one. It's our CARES Act COVID-19 considerations. Can we advance one more slide? I've talked a fair bit about the federal grant work that will happen a little bit later over the $38 million. But one other item that is in your financial statements, there were certain advance payments that were received from the Medicare program that are ultimately going to be offset against future services that you provide to those patients. And so that's one other item that also helped with the liquidity for healthcare entities. So you have some extra cash, but you've also reflected that as a liability. That was not an insignificant amount that OHSU hospital received in relation to that. But the other aspect of things is, obviously Lawrence reported on the financial results, the challenges in operating income this year compared to the historical periods over the last 10 years. We do look closely at compliance with financial covenants and your debt agreements, things of that nature. We're in good shape in relation to that. We also look at the projections for the coming year and the way management is going about managing the organization to ensure compliance in the future. Again, while we don't have a crystal ball, we can't tell you what's going to happen. We're comfortable that future compliance is going to be reached, and that we'll be monitoring that with management as it relates to your key debt agreements and such. So There are some things that we did process-wise a little bit different. As Lawrence mentioned, it was very much a virtual experience throughout the entire audit for this year. And again, the process went well, and we know it took a lot of extra effort for the finance team. And I appreciate the nimbleness of my folks too as well, because they're all working from their homes and hoping their internet is going to do what it needs to do to get through each day. So I did flip past the last slide. It was maybe if we go backwards one slide. This was the summary of some of our key audit areas. This is the same list that we started with for the audit for this year. Again, we focused again a fair bit of extra time on some of the CARES Act oriented things, but in addition, I guess excluding that, everything else went according to plan, and that we had successful results in each of these key audit areas where we do quite a bit of testing and procedures across the organization. So those were the things that we wanted to cover with the board today. And maybe I can pause here to open it up for any questions that you have for me as the auditor.
Anyone has a question, you can raise your hand or type it in the chat. I will say, as we wait for anyone to identify that, we had a good review in the Finance and Audit Committee. I don't have any other questions. This is a thorough review. It's good to see a clean opinion with the finance staff here, Lawrence's team. So we thank you for your efforts, and look forward to continued good results like this from an audit perspective. We can't control the numbers, but clearly the process is working and worked well. So thank you for getting this done. Being in finance myself and seeing how we need to get through an audit. My company just announced our earnings yesterday as well for the year. It's not easy to do this in a virtual environment. So I applaud you and your team in getting that done. I don't see any questions. The audited financial statements do need to be approved by the board. So at this time, I will entertain a motion to approve the audited financial statements.
I'll make the
This
motion.
is
Steve.
I'll second the motion. Chad Paulson.
The motion has been received and seconded. Are there any further questions? Seeing none, I'll ask Ms. Seeley to call the roll to approve the audited financial statements for FY20.
Director Tyson.
Aye.
Thank you. Director Paulson.
Did you hear me? Yay.
Yep. Thank you. President Jacobs.
Aye.
Director Khan.
Aye.
Director Dubé.
Aye.
Director Byer.
Aye.
Director Chamberlain.
Aye.
Director Zika.
Yay.
And Chair Monfries.
Yay.
Okay.
Thank you. The financial statements for FY20, audited financial statements have been approved. Thank you for that, board. We will now turn it back to Mr. Fernstall to go through the Q1 financial results.
Thank you, Chair Monfries and members of the board. Next slide, please. Well, it's only a month since we came, but I'm pleased to report that September results are very consistent with the June through August data that we used for the revised budget approved by this board last month. Revenues within $1 million of budget, while spending on services and supplies is trending lower, which is a positive thing. The revised budget deficit of $55 million is spread unusually this year because of the salary reductions and other expense deferrals that were taken in the first quarter, but are restored going forward starting in quarters 2, 3, and 4. So the budget spread is a $19 million gain in July through September, followed by a $74 million loss in October through June. Again, primarily driven by the salary restoration on faculty and UAs. So on that basis, and so we can get a apples to apples basis, Actual results through the first 3 months are $6 million ahead of the revised budget, $1 million in revenues and $5 million in lower expenses. Next slide, please. Net patient revenue is slightly greater than that, about $5 million above target. It is nonetheless down about 1% from last September, and that's consistent with overall patient activity. Admissions are down 11%, primarily driven not by any lack of demand, but the fact that the university has 30 beds, approximately 30 beds that were in double rooms out of service because of COVID-19. But that is offset or nearly offset by case mix or complexity, up 8%. And our case mix is nearly 2.5 at this point, and it had already been among the very highest of university teaching hospitals across the country. Surgical cases are also down a bit, and again, that reflects the bed capacity and the slower throughput under COVID-19 conditions rather than a lack of demand. But outpatient pharmacy services, and particularly cancer and neuroinfusion, are up 19%. 30% of our ambulatory visits are now being done virtually. Payer mix has still not shifted despite pandemic-related job losses, and that's been a financial positive. The first quarter over first quarter, essentially flat trend in revenue and expense, while much better than we had initially anticipated back in May and June, does compare to an overall growth trend of about 5% in volume and 7% in revenues that we had secured on average over the prior 9 years. So we are leveled off, but not yet back to the trajectory given all the impacts of the pandemic. Expenses are also flat from last year, and thus a strong first quarter operating income. But as I noted earlier, they don't yet include incremental spending in the revised budget from salary restoration, contract negotiations that are underway, temporary FTEs we believe are required above current staffing levels due to COVID-19, and various other adjustments. Next slide, please. Net worth has also recovered about half. If you look at the 4-month period from March through June, so the very sort of belly of the curve of the COVID-19 impact, the net worth of the university fell during those 4 months by $122 million. It had been up in the prior 8 months, but it really did decline substantially. About half of that, $62 million, increase was recovered in July through September from the Q1 operating gain, continued good investment returns, and we did receive another $10 million of CARES Act grant support that we do get to keep. So that brings the total up to $48 million to date. We don't have clear visibility to any additional grant support from the CARES Act, although it is unclear what might happen with further federal stimulus. Both that, our cash also increased, driven by two reasons fundamentally. The investment returns, the fact that we have deferred a great deal of capital spending, so you can see our net property and plant and equipment is actually down $27 million during the quarter. And we continue to get additional loans out of the CARES Act, largely from the deferral of FICA payments. Both the improvement in net worth and the improvement in cash in the first quarter are likely to halt or reverse in the coming quarters as salary restoration and other incremental costs shift the surplus in the first quarter to a deficit we project for the remaining 3 quarters. Next slide, please. If I could conclude, the good news I would say is that if we could repeat Q1's positive variance against the spread budget for the remaining 3 quarters, in other words, if we could be above where we expect to be by $6 million for 4 quarters, that would be, of course, $24 million. And that would be sufficient to fully repay the 12 weeks of faculty and administrative salary reductions taken in the summer and still be within the $55 million revised budget deficit. And that's, of course, what we're aiming to do. There are still significant uncertainties this year and next, whether COVID cases, which are increasing in Europe and in much of the United States, and we'll hear from Peter Graven later about Oregon, whether they will increase and what impact that might have as we go into the winter, whether or not payer mix will hold or shift if employer health coverage runs out. There are always pressures for new spending. The legislature will convene in February and will have to balance next biennium's budget. There are new federal regulations that expand leave for COVID-related childcare that impact public health sciences at academic health center institutions particularly. There's uncertain prospects for further federal stimulus. Of course, we have an election next week. And the Affordable Care Act is once again before the United States Supreme Court on November 10th, and there is a different bench. However, with all of those uncertainties, we have preserved our underlying financial position, and that has provided us a platform to climb back to where, once again, revenues cover expenses on an ongoing basis. With that summary, I'm happy to answer any questions.
Thank you, Mr. Fernshaw. I believe the first questions are from Mr. Dubé.
Hi, Lawrence. Just two quick questions. One is the 30 beds that were down in terms of capacity because of doubles going to singles. Is that the only capacity reduction overall?
It's the largest and most direct one. I would say the other capacity has to do with turnover time and throughput under COVID-19 conditions, which isn't so much that we have capacity out of service, but that the capacity we have, it's harder to get the same amount of throughput that we might have had before. But the largest definitely
longer.
Yeah, that's right, sir.
The average length of stay is much longer than before.
Yeah, and that is because that's not related so much to COVID, but related to the cases we have at OHSU now are the ones that most need to be at an academic health center and thus are most complex. So the length of stay being higher is directly related to the case mix being higher.
The acuity. Okay, thank you. Second quick quote. I'm sure I'm conflating this, but you reported in our total cash position the interest in the foundation. Is that always reported as a line item there?
Yes. So within our balance sheet, because the foundation exists for the purpose of supporting OHSU, it is a consolidated or combined into our balance sheet. Our interest in the foundation is the net worth or the net assets of the foundation, which is essentially entirely the value of the endowment and gifts that have been received but not yet spent. So that is always a line there. Yeah.
Okay, thank you, Lawrence.
Ms. Tyson?
Yes, thank you. Good morning. Lawrence, I wondered if you could elaborate a little bit more on the FICA impacts for the repayment of that loan and how you envision that will be handled.
It's a moving target. There are two pieces. If you would actually move back one page, one slide, whoever is running the slides. There we go. You see that as of September 30th, there are CARES Act loans of $188 million as of September 30th. There are two pieces there. One is $145 million of Medicare advances that were given to all Medicare providers early in the pandemic. And initially, those were scheduled to be repaid through sort of deductions from future payments about now in the time period. That has been deferred into next year. And the various bills that the Republicans and the Democrats were considering, but haven't yet come to agreement, had extended that a bit further. So it's unclear when it will be repaid. At the moment, it's not due back. They are not recouping it, and they're not charging interest. So we're holding on to it, but we have the cash on the green line, if you will, to pay it back. The FICA deferral is a little bit clearer. Under the CARES Act, employers are allowed to defer the remittance of our portion, the employer portion, 6.2% of wages through the end of this calendar year, through December 31st. And then it's repayable in 2 equal periods over the next 2 years, again, interest-free. And again, we're simply going to take advantage of that because, it provides liquidity. We have a small amount of investment earnings on it, and we're not paying any interest on it. But we are not spending that money, that we are holding that on the other side on cash and investments so that we don't incur excess risk.
Thank you. So my questions, if we go to the key revenue and expense trends slide, which is one up, I believe, from this.
If you could go back, that one, yes.
That one, yeah. So we're saying that expenses are flat in the quarter from last year, but don't include the incremental spending following. There's a list of 6 things.
Yes.
Some of those are included in the revised budget. So, for example, I think the salary restoration is included in that negative, the $55 million loss. However, we don't know, the things we don't know are where the contract negotiations come out. We probably haven't budgeted for the temporary FTEs and the child care emergency fund and new leave costs. I'm assuming the equity adjustments and other initiatives are not included.
Actually, Chair Momfries, we made estimates of all of these items in the budget, so they're all included. And that's why the budget is spread with a gain in the first quarter and a bigger loss in the second, adding up to 55. So we should be okay if we hit within those estimates. Like all budgets, there's a certain amount of it. But we did make a sort of decent attempt to estimate every one of these items in the revised budget that the board approved last month.
Okay, excellent. Thank you. Other questions? Okay, I don't see any coming in through the chat. So again, a thorough report. Thank you, Mr. Fernstall, and thank you, Drew, and the team at KPMG, as I said before. So thank you all for this. I guess we'll move to Dr. Karen Eden for the Faculty Senate report.
Thank you, Chair Momfries. Can you hear? Good afternoon. I'm Karen Eden, the Senate President, and I bring you greetings from the OHSU Faculty Senate. Thank you, Board of Directors, for your service and for meeting with the senators virtually in this crazy new world we're living in. So thank you. Next slide. Like other public and private universities, OHSU has a Faculty Senate with a mission to represent the faculty. Next slide. The Senate proposes, evaluates, and advises OHSU leaders on policies, activities with OHSU-wide impact affecting schools or units. It provides a means by which the administration may be apprised of the representative opinions or concerns of the OHSU faculty. And it provides a means of communication from administrative back to the Senate and to the OHSU faculty at large. Next slide. The Senate represents 2,900 faculty. In the June 2020 Senate election, 8 seats were filled. The Faculty Senate seat apportionment breaks down to 12 School of Medicine, 6 in School of Nursing, 4 School of Dentistry, 7 in the affiliated units, centers, and institutes, 1 for the School of Public Health, and 1 for the College of Pharmacy. Next slide. In this slide, you see the current Senate leadership. In the docket that was sent out earlier, you'll see a couple of slides with the 31 senators and the units they represent. Next slide. So today I wanted to spend most of my time on Senate activities and priorities. and this figure depicts the committee structure within the Faculty Senate. I will focus on the Faculty Affairs work groups where all senators serve. The Faculty Affairs Committee reorganized last year into formal work groups so that they can act in a fairly rapid response. All senators serve on one of these work groups. Let me share with you now what each of the work groups are working on. The Faculty Voice work group, next slide. The Faculty Voice work group ensures that the opinions, concerns, and experiences of OHSU faculty are collected, analyzed, documented, and recommendations are shared with OHSU leadership, faculty, and the larger OHSU community. We are currently organizing multiple 45-minute listening sessions with faculty to begin November, December. We're exploring innovative ways for the Senate to receive timely feedback on important and emerging issues. Next slide. The Faculty Rights and Responsibilities work groups advocates for consistent, transparent, and equitable policies, procedures, and metrics related to faculty compensation and benefits, expectations, evaluation, promotion and tenure, diversity and gender equality, disciplinary actions, and dismissal. Currently, this group is reviewing the Code of Conduct, the Discipline Guide, and the Grievance Policy for consistency in policy and process. The Monitoring Institution Responses and Outcomes work group has a charge to ensure that OHSU faculty recommendations addressing faculty concerns are reflected in OHSU policies, initiatives, and the actions taken by leadership. This group is currently monitoring ongoing initiatives in salary, equity, diversity and inclusion, racism, and related OHSU policy. Next slide. The Senate connects with leadership at every Senate and Senate Executive Committee through the attendance of Provost Elena Andresen and Executive Vice Provost David Robinson. President Jacobs and CFO Lawrence Fernstall meet with the Senate and the Senate Executive Committee throughout the year. And this, of course, has occurred often because of our COVID and all of the many decisions that have to be made along with that. These leaders bring us information to inform and obtain feedback regarding leadership decisions. Next slide. I have standing meetings with the OHSU President, Provost, Chief Administrator Office, and the School of Medicine Dean. I represent the Senate on the President's University Cabinet, and the senators serve on OHSU committees and councils and the Oregon Interinstitutional Faculty Senate. And I've listed a few on this slide, but in your docket, you'll see the many committees and councils that the senators serve on. Next slide. We have two main communication strategies. We use the OHSU O2 website, and we also leverage the OHSU Now email and post. Coming in 2021, we want to move toward using Microsoft Teams so that we can better reach our schools, colleges, and units to facilitate communications between faculty constituents and senators. Next slide. Now, you've seen the priority slide from before, but today I just want to give you a little update on what the current activities are. I'll start with pay equity. The Oregon Equal Pay Act went into effect January 1st, 2019. Two senators continue to serve on the Data Governance Steering Committee that is advising on the creation of a system to evaluate salary equity and gaps. Providing equal pay for equal work is not only the law, but key for retention and for attracting new faculty to OHSU. Next, I'll move to financial security. As you know, the Faculty Senate advocated for salary restoration and was pleased to see salaries prospectively restored in the September 28th for all faculty in UAs. And today I was pleased to hear Lawrence Fernstall mention they're trying to protect money to pay the faculty in the UAs back. So thank you very much. Dr. Robinson will be providing an update to the Senate on the plans for the new compensation plan that will go into effect for fiscal year 22. Next slide. As I reported earlier, we are definitely struggling with low faculty morale and burnout, particularly during COVID. And it's a major concern, and it's costly when faculty leave. As you may recall, the faculty well-being effort was folded into the larger People First objective of 2025 planning that addresses diversity, equity, inclusion, workload, well-being, and safety. While the 2025 priorities are delayed during COVID, we proposed 2 ways OHSU could support faculty. One is to expand mobile apps and platforms to include emotional support, daily in-the-moment meditation, and help with sleeping, expand virtual well-being in classes, and I realize that some of that has actually recently occurred. We also proposed that the nationally recognized resident and faculty wellness program be expanded to address needs of all faculty. Currently, the program is funded by the School of Medicine and serves the School of Medicine faculty. As budget allows, the 2025 strategic plan will be revisited, and we request that resources for faculty well-being and safety be prioritized. Next slide. As individuals and as a body, the Senate has a role in making changes at OHSU to support diversity, equity, and inclusion. The Senate advocates for processes and policies to advance workforce diversity, achieve an environment in which all individuals are treated fairly and respectfully, have equal access to opportunities and resources, and can contribute fully to the full and free development of scholarly learning, teaching, research, patient care, and community service. We are partnering with Dr. DeBouvier, Senior Vice President of Diversity, Equity, and Inclusion, on institutional efforts to combat racism and support diversity, equity, and inclusion. Currently, we have senators serving on the Diversity Advisory Council focused on this work. Next slide. As I mentioned in June, the Senate co-sponsored a proposal to expand the Respect for All app to address racial discrimination, and leaders supported that expansion. If you would like to see the app, you can go to Google Play, or you can go to the iPhone App Store, or you can actually go to it through your PC. So as you can see up here, how you can connect. This is a tool that provides resources for employees, students, staff, and faculty, not only for use for themselves, but also for supporting someone else should they have questions, and also provides guidance on reporting requirements, because many employees may not realize that they actually need to report, and this tool provides some education and guidance on that. So in November, we have funding, as I mentioned, from leadership to begin the expansion of this app to provide resources to address racial discrimination. Currently, it's focused on gender-based discrimination, stalking, sexual misconduct, and assault. Next slide.
Thank you. I believe Mr. DeBay has a question for you, Dr. Eden.
Sure.
Hi, Dr. Eden. So obviously the management as well as the board has tremendous amount of respect for the faculty, and as evidenced by one element, which is restoration of salaries, but we realize that's just a small element. The overall well-being of the faculty needs to be monitored on an ongoing basis. So one question for you is, given how long this pandemic has gone on and how long it's expected to continue, obviously constantly monitoring faculty well-being is critical, because it'll change as time goes on. What mechanisms are you using to constantly monitor it? Is it anecdotal, or is there a survey sent out, or keep track of it generally?
I'm glad you asked that. So there was a COVID wellness survey that was sent out. We did, I think we saw some preliminary results of that. As you might not be surprised, there was a concern about burnout. And I believe that will continue to be sent out. It's not actually sent out by the Senate. It's actually sent out by a different group, maybe perhaps the Wellbeing Group. So I can't speak specifically to that. But one of the things we hope to fold in will be concerns related to this from our listening sessions. So we have planned several listening sessions, and one of the aspects of the listening session will be to address the concerns you've just raised.
Mr. Zika?
Yeah, thank you. And I'm not sure this is a question for you, Doctor, but maybe it's a follow-up to what that discussion was just previously. What are the turnover rates we've seen in faculty and maybe all employees, just in general, in the last 9 months. I have no doubt the stress level is up throughout our employee population, but what are the actual turnover numbers showing?
So I'm glad you asked that. We have been asking that as well. And Greg Moab is tracking that. And I think Lawrence can probably speak to it, but I understood we typically have about 10 to 12%. I don't know how that rate relates to departures, particularly in July. I am aware of a number of departures in July, but I can't speak to the overall rate. But I believe Greg Moab is tracking that. What?
I don't have the table exactly in front of me, although we produced one. It's about at the same rate we had prior. So, for example, we produced a report for Dr. Jacobs that showed departures and new hires for faculty and the key areas of staff, administrators, nurses, other hourly staff, being about level over the last 4 months in particular we had focused on. I think there's probably offsetting impacts. There's no doubt a higher level of stress, and people have, employees have childcare responsibilities and other things. It's also, not the easiest time to be looking for an alternative job too, because of COVID-19 as well, and they're probably offsetting factors.
Yeah, it's a good point. We might see some of that later as we start to come out of this. So thank you.
It's a good question. You should know the Senate is actually asking for those data too, because we would like to know. So I'd like to
just real quick, Dr. Eden. One of the things we've talked about in some of the faculty breakfasts is mining the rest of the country and other academic health centers for best practices in coping with some of the challenges. Is there a work group or any processes that the faculty are using as a body to identify those, to bring back suggestions to the leadership?
There has been a faculty wellbeing task force that was activated prior to and during the planning of 2025. I know some of those. I was on that task force, and I'm aware of some of the work going on around the country. I'm not aware that task force is working as much as it could be right now. But that's a good point. I can follow up on that.
Okay, thank you.
Mm-hmm. So if we can go to my last slide. I want to personally thank Dr. Amy Garcia. Senator Amy Garcia is leaving OHSU in December 2020 to join her family in Minnesota. She will take a position as a solo pediatric gastroenterologist at Essentia Health in Duluth, Minnesota. She commented that this is as close as she can come to rural practice as a pediatric subspecialist. She's been a faculty member at OHSU and the Department of Pediatrics since July of 2012, and she took on the role of the Assistant Dean of Student Affairs for the School of Medicine in August of 2018. She served on the Faculty Senate since 2016, representing the faculty and her particular unit, Unit E, and she served as the Secretary of the Senate Executive Committee since 2018. She's been instrumental to many endeavors in the Senate, and her distinguished service will be missed both in the Senate and the OHSU community. So we wish to send Dr. Garcia off with our good wishes for great success in her new endeavors. Thank you.
Thank you. And having worked with Dr. Garcia, particularly from a faculty senate role and at the breakfast and her interaction, I will echo your comments on behalf of the board, thanking her for her service to OHSU and wishing her the best in the next chapter in her career and her life. Thank you, Dr.
Thank you. I don't know if there's any other questions or
any other questions. I don't see any in the chat. Okay. I'm assuming there are no other questions for you. So thank you for that report.
And I also want to really thank the board of directors for being willing to meet with us. It really helps to be able to have informal dialogues throughout the year. So thank you very, very much for giving so generously of your time.
Our pleasure. All right, we'll move forward with Tim Marshall for the annual integrity report. Mr. Marshall.
Good morning, Chair Monfries, board members, and guests. Can you hear me okay? Everything sounds good? Great. I'm Tim Marshall, the Chief Integrity Officer at OHSU. I just wanted to say thank you for this time to provide the annual update of the integrity programs at OHSU. I will provide information regarding the elements of an effective compliance program, describe what this means to you as OHSU board members, highlight integrity responsibilities and current initiatives, and provide some details regarding the integrity hotline, its volume and activity. Next slide, please. As detailed here, integrity is defined in the Code of Conduct, and all OHSU members are expected to commit to the spirit of this definition. The roles and responsibilities document also highlight expectations for all OHSU members regarding ethical conduct as part of their daily performance and responsibilities. Next slide, please. I've highlighted a few items on this slide regarding roles and responsibilities. The Chief Integrity Officer serves as a knowledgeable resource, evaluates and elevates issues, and seeks information and resolution from appropriate personnel across the mission and institution. The board and executive leadership are expected to uphold ethical, organizational, and operational integrity through embodiment and execution. Next slide, please. For effectiveness to occur, the organization must exercise due diligence to prevent and detect misconduct. This can be accomplished through policy and procedure, enforcement, and monitoring activities. The organization must also promote an organizational culture that encourages ethical conduct, behavior, and a commitment to compliance. The Code of Conduct helps to highlight what this cultural expectation should be, but most importantly, this culture of ethical behavior needs to live with each OHSU member. Lastly, compliance programs need to be reasonably designed so that the program can be generally effective in preventing and detecting misconduct. Next slide, please. This slide showcases what those 7 elements that help promote and ensure the effectiveness of compliance functions at OHSU. The first one, written policy and procedures. These provide the guidance that OHSU members use to work in a structured environment with consistent behavior. For the second one, program oversight and governance, we look to you as board members, supported by leadership at OHSU, to provide the necessary oversight and guidance and to ask questions in order to ensure that compliance functions at OHSU are appropriately resourced, supported, and managed to fulfill the expectations of the functions. For the third one, training and communication, OHSU members receive a variety of training as part of their roles and responsibilities daily. OHSU Now, the internal OHSU communication method, and other communication vehicles provide information necessary to all OHSU members on a daily basis. Is training relevant? Is it up to date and assigned appropriately? And we improve communication methods and our OHSU members receiving the information that they need in a timely manner and support their daily roles. These are questions that we often ask when we talk with them. For the fourth element, monitoring and auditing, these activities are very important to help the organization verify that policies and procedures are being followed, that business objectives are being achieved in an efficient and effective manner, and that opportunities for improvement are being recognized and implemented. For the fifth element, hotline or other effective reporting mechanisms, the Integrity Office manages a third-party hotline in which concerns and issues can be reported. This system provides an avenue of anonymous reporting if the reporter does not feel that they can report and resolve the issue directly with management. I will provide metrics regarding the hotline later in this presentation. The sixth item, disciplinary measures, is important to enforce disciplinary measures for individuals who do not abide by the expectations of behavior for OHSU members. This could be the result of a code of conduct violation, a scientific or academic misconduct issue, or even simply behavior that simply goes against OHSU policy, which there are many. OHSU is in the process of implementing a disciplinary and remediation guide, which actually Dr. Eden just referred to help assist in consistent disciplinary actions and decision-making to support this element. And lastly, the seventh element is around prevention. Risk assessment and modification of programs to reduce risks are invaluable business processes that allow integrity programs as well as OHSU leaders to optimize operations and be efficient and effective with resources. As an example, the Audit and Advisory Services Program completes an annual risk assessment as part of their audit planning process. Next slide, please. I'd like to share this diagram as it reflects how the Integrity Office is linked to and works with several integrity and compliance-based functions at OHSU on a daily basis. We collaborate and have open dialogue regarding many of the 7 elements of an effective compliance environment at OHSU and work with and support the functions as needed. Compliance is an enterprise-wide responsibility, and we encourage collaboration through quarterly meetings of the Compliance Partnership Network, as well as daily communication throughout the organization. Next slide, please. The Integrity Office is staffed with 4 individuals, including 2 assistant integrity officers, an integrity analyst, and an administrative support person. On a daily basis, the team monitors the integrity hotline, integrity inbox, email, and phone. Oftentimes, this results in the review of an issue in collaboration with other integrity functions to review and resolve. On an annual basis, the Integrity Office produces the Integrity Booster, a training meant to provide updates on emerging issues, new policies, required topics such as fraud, waste, and abuse, and refreshers on certain topics, including the Code of Conduct. This is required training for all employees, students, and board members. An Integrity Foundations course is also provided to new employees as part of their onboarding process. The Chief Integrity Officer conducts the Integrity Program Oversight Council, better known as IPOC, twice a year, which some of you are members of. The Integrity Office also conducts and supports investigations throughout the year and participates in various compliance-related committees and groups. Lastly, metrics are maintained for the Integrity Hotline cases, which I wanted to share with you now. Next slide, please. OHSU contracts with a third-party company called Navix Global and utilizes its software called Ethics Point to report concerns confidentially and, if desired, anonymously. The hotline can be accessed via phone or a web portal. Information is captured in Ethics Point and cases can be triaged to other operational groups such as HR or Information Privacy and Security for review and resolution. The next 4 slides will highlight some metrics from this system. Next slide, please. This is a slide that represents total cases by calendar year. As you will see, there was an increase from 2016 through 2018 as a direct result of the OCR resolution agreement, in which OHSU was held from a couple of breaches back in the early 2013 during 2016 to 2018. It was a 3-year cap. The result, the nice thing that we saw from this is that through enhanced training and reporting requirements, we noted an uptick in hotline cases that came through, which was great to see. There was also a decline in cases processed in Ethics Point in calendar year 2019 due to the Information Privacy Security team utilizing a new system called Radar starting in March of 2019. Next slide, please. This slide represents total cases by mission. Where do the hotline cases, what are they pertaining to? As you will note, there are majority are healthcare related cases and mostly in the information privacy and security area. Next slide, please. This graph shows cases by area. So as you'll note, the majority are in the HR area or the information privacy and security area. The other areas are the bullet asterisk below includes AEO, integrity, and clinical integrity. And you also notice here that we saw the spike that happened as part of that OCR resolution agreement in 2016 through 2018. And the next slide. And the last slide I wanted to provide on hotline metrics was around case outcomes. There is a mix of unsubstantiated and substantiated cases. This data is entered in the system as part of the review process, and when cases are completed, they are marked as completed. Substantiated cases may lead to disciplinary actions up to and including termination or expulsion, depending on the situation. Next slide, please.
Quick question, just can you defer for me between dismissed and unsubstantiated? How do you draw that line?
Yeah, sometimes cases need to be dismissed, either if it was anonymously reported and the reporter does not come back in if we have specific information that we want or need to continue the review. There's a unique code within the system that allows any reporter to become and stay anonymous. But if, for example, a date or a time or a place is not identified as part of the concern, and the reporter is not able to come back into the system, or it does not come back into the system, then that simply sometimes just has to simply be dismissed on the evidence provided, or the information provided is lacking. We can't move forward.
Thank you.
Any other questions today? Okay, next slide, please. On the next few slides, I just wanted to provide an update on Integrity Office initiatives for the current fiscal year. Next slide, please. The first one is around the Code of Conduct, review and update. As you may or may not be aware, the last major code update was performed in 2015, about 5 years ago, and was aided by a third party. The current review and update started in February of this year and followed Dr. Jacobs' State of the Union address in January, in which he mentioned that the code was going to be reviewed and updated. And the review currently has included collaboration with content owners, key stakeholders, leadership, OHSU member crowdsourcing, focus groups, and a public comment period that is ongoing to ensure that all voices are heard as part of the review and update process. We look forward to bringing the new and improved version of the code back to this forum for review and consideration, hopefully in January. Next slide, please. Around integrity and compliance collaboration, we have continued integrity and compliance collaboration through the Compliance Partnership Network meetings in order to continue networking and sharing ideas, including current initiatives, emerging issues, and regulatory concerns. During the time of COVID, this has also helped us to prioritize items such as training, as well as other monitoring and auditing activities. We have supported the organization and other programs through training updates and developments, such as the return to campus courses, one for employees and one for students. For employees, as part of the University Transition Task Force. We also recently helped develop a course regarding hazing for the Provost's office as a result of a state law that came into place. And several courses have been updated with the environmental health and safety team as a part of their transition from an old system to our current Compass system. Next slide, please. Education and training. We also continue to partner with HR and clinical education services regarding required regulatory trainings in the Compass Learning Management System. OHSU training policy was finalized in the spring of 2020, but then COVID hit. Some of this work has been deprioritized during modified operations and other priority training needs, such as the return to campus courses, but we hope to re-engage and start moving forward on several of these items in the near future. Next slide, please. Monitoring and auditing. Integrity in the Audit Advisory Services programs, which report to me, have been involved in several reviews during the current fiscal year. We are currently performing a follow-up review that we did last fiscal year for the School of Dentistry around health information management. The Audit Advisory Services team recently completed a GAAP assessment for the Cures Act requirement of information blocking in partnership with the Clinical Integrity team. This group will also be performing a review of CARES Act funding during the year. The Audit Advisory Services team and Clinical Integrity teams manage their own work plans and perform reviews throughout the year. Lastly, Integrity monitors compliance of the required training for new employees to ensure completion in a timely manner, which is at 2 weeks from start date. This training includes the Integrity Foundations course, the Information Privacy and Security Essentials course, and the Respect at the University course. Thank you for your time today, and I would love to answer any questions that you may have.
Thank you, Mr. Marshall. Mr. Dubé has a question.
Well, if I would have attended the IPOC subcommittee, I probably wouldn't have this question, so apologies, Tim. But one quick question, does this cover the entire consolidated OHSU? In other words, is Tuality included, Dornbecker included?
I would say, well, Dornbecker is absolutely included as that's part of kind of the OHSU model. In regards to Hillsborough Center, some things are covered. And when I say covered, we do not handle the hotline at Hillsborough Medical, but the clinical integrity team, who is contracted to provide compliance services there, do manage the hotline there. The information privacy and security team also performs that function for Hillsborough Medical under a management plan or an MOU with Tuality. On the Adventist side, there's some similar things. So I would say from an oversight perspective, I personally don't have influence on the Hillsborough Medical Center operations from my office, but there are several integrity and other compliance functions at OHSU on that diagram that do provide services for those affiliated partners.
Sorry, one quick follow-up question. When you showed the consolidated 3-year 16 to 19 calendar year, it might be interesting in any subsequent reporting to sort of break it out by year to see what the trends are, the upward or downward. And also a related question is, I mean, is this from a principal perspective? It's if you see something, hear something, say something. That's really the idea behind this. So reporting is not discouraged, rather it's encouraged. So when you see an uptick, that's not necessarily bad, right?
No, I think if you have more reports, I think that's a good sign that people are feeling comfortable to speak up. I think what we like to try and do is have things resolved on that peer-to-peer basis or the peer-to-supervisor basis or within departments. And that's why we kind of encourage having that dialogue. But if an individual at OHSU does not feel comfortable, then they have other options. One of those options being the anonymous hotline reporting. They could also go to an HR business partner. They could go to AEO to talk about a discrimination or a harassment type issue. So again, I think we want to make sure that we encourage employees to report, and it just depends on what mechanism they feel comfortable doing so.
Okay. Thank you, Dr. Jacobs. I see your comment in the chat room. Appreciate it. Those are all my questions, Tim. Thank you.
So my question, Mr. Marshall, is about in the COVID environment, have you seen any shift in the number of reports or the mix of types of reports that you're getting in any way?
Speaking to the hotline specifically, I would say that early on we received a few probably more COVID related, so-and-so's not wearing a mask or people aren't social distancing, things of that nature. But then I think in probably the last, let's say 2 or 3 months, it's been relatively stabilized, and we receive about 8 to 10 reports a week. Majority of those being, again, HR related or privacy and security related concerns. But I would say we had a little bump at the beginning, but I think it's stabilized in the last 3 or 4 months.
Thank you. I see no questions in the chat, so I want to thank you for your report. Thank you for your time. I know it's challenging times on this, but you're doing to keep us moving forward with integrity in this institution. So thank you.
Great. And if there are specific data elements or metrics that the board would like to see, either through the IPOC process or through this public process, I would happily love to hear what those would be, and we can see what we can do about those.
Great. Thank you. We're going
So
to
much.
pivot to Dr. Graven for the OHSU COVID-19 forecast and trends. Dr. Graven, you might be on mute. So we're a little early. So do we know if Dr. Graven is on? Ms. Seeley?
I will confirm. Hold on. I'm using all my tools here. Hold on.
Someone in the chat said it doesn't appear that he's on.
I don't think he is. I'm trying to rouse him.
So what happens when we're being efficient?
I know we're being very efficient.
That's all right.
And I do not think we have Dr. DeVivier yet either, or I'd suggest we just flip the item.
Just a general question for the leadership on the call. I saw a report today that health centers are being hit with malware around the country. Do we have any thoughts or activities that we're doing to protect ourselves?
So Wayne, this is John Hunter. I was actually on the call this morning at 7 a.m. with the FBI and the Health and Human Services and one other agency that's involved with cybersecurity, just in the listening mode. And they were very taciturn, I guess is the right word, about exact who had been hit, how, and in what ways, because they were in the midst of investigating them. But I immediately alerted Bridget, and I don't know whether Bridget is on this call or not.
I can add, John. This is Lawrence, just connecting with Bridget. We're monitoring the situation closely. We're well prepared. We have, as I know the Finance and Audit Committee has heard over time, a very large data security effort, and we are constantly batting back attacks. The main vector comes from phishing attacks, and we have, I think, done a really good job training, because there's a human factor piece of it, training the members of OHSU when they receive a suspicious email, not to, click on the link. And we do our own testing and training regularly on that. And I know that myself because I get them frequently. Indeed, we just had a training exercise on the data security team yesterday around this issue.
Great. Well, we'll keep our eye on that. I'm sure Bridget and her team are all over it. So thank you for that, Lawrence and Dr. Hunter. I believe Dr. Graven has joined us. Thank you, Peter. We were running a little early, so thanks for pivoting and joining. I know you're quite busy, and we appreciate you taking the time to update us on what's going on with regard to COVID around the state and for the university. So I'll turn it over to you, Dr. Graven.
Great. Yes, happy to be here, and sorry for being late. It is rare that you're ahead, and so I like it. Yeah, so I'm going to go over. This is a presentation I give pretty regularly with a lot of data that I look at every week. For people who don't know, I spend probably half my week trying to review data and put together a briefing that goes out once per week. And so this is a few of the things that I'm noticing and hopefully are relevant to you all. Next slide. Yeah, I talked about this in the Markham talks. This is the attention grabber. Lives saved. People have talked about the curve and flattening the curve. The reality is we have flattened the curve quite a bit already. So if unmitigated, this would have been over and done with in July, and we would have, but we would have had maybe 26,000 lives lost in Oregon. And so it's worth noting that yes, we have flattened this. It's wanting to, we want to hold on to that, but I think it's worth recognizing that it's not that we haven't accomplished anything by the sacrifices that were made. And so I like to put that out as just maybe it's good news, depending on how you think about it. And so, but there's been deep consequences. Next slide. The economic crater, we hear about it in the news. And of course, there's huge adjustments to our various industries. Many of them have returned to where they were. So I'm showing you a chart here of the employment growth by the different wage categories. And what you can see is low and high wage groups have mostly returned to their pre-pandemic levels of employment, but the low wage groups have not recovered at all and are continuing to be low. So in addition to the economic effects, we have a mental health crisis, which is observable, and we know that there's more that we aren't able to observe. We have a big topic of education and how do we deliver education in this environment. Huge difficulties there that are brought on by the decisions we're making to protect ourselves from transmission. The nursing home, we have consequences there. People end of life who are not getting visitors, and we know that the tragedy that goes with that. We also know that nursing homes are where this virus can take a real toll. There's abuse that goes on, both substance, physical, and mental, because of all these actions we're taking, and those need to be recognized. I'm an economist, and so obviously I do think about the economic part of it, but it's all these factors that are sacrifices we're making to prevent the spread. And then finally, we have to recognize the disruption it's had on vulnerable communities, in particular communities that cannot work remote and live in environments that make it so transmission is quite easy. Those kinds of situations has caused real problems. Next slide. This is supposed to be helpful. Humans are much better at adapting than preparing. The reality is we've had huge innovations due to this in distributed work. Entire industries have been able to convert into online or remote or telehealth. We've had virtual healthcare that's just exploded. Online schooling, I know everyone's struggling with it. We're learning things every day and really getting some innovations there on how to do that. People have been able to re-engineer the safety precautions of their business, including shields, masks, re-engineering how it operates, ventilation, touch-free elements. All these are really innovations and inventions that are happening all the time. So you have to also recognize that while we're making these sacrifices, people are making a lot of new things are coming of it. And I'm showing a small chart of just like the things that people are spending money on. You see a lot of what people aren't spending on and the industries affected, but that money is going somewhere else in many cases. And so it's important to kind of recognize how this represents change and opportunity as well for many people. Next slide. Balance. Okay, so this is the idea of we're doing some ups and downs in Oregon and actually around the country, and I'm showing the idea that there's essentially society is thinking of some tolerable level that they can sustain. and that you're going to be moving around it and trying to manage it as through policy and through societal preference. And so each area is going to have their own kind of whatever they're comfortable. Oregon may be different than a different state, and even in particular local areas. So the question is how do we do a good job of adjusting to where we are comfortable? How do we know if it's spreading too fast? Well, I can tell you it's spreading too fast if the hospitals are full and if the staff are getting burnt out. And that's an absolute capacity constraint that we have in dealing with COVID. There are other things, other people are affected as well, but that is a pretty hard constraint that we've seen be pushed to the limit at many times in the pandemic in various places. So I think it's fair to think of that as an issue, and which is why the diagram kind of shows, if you're thinking about how the situation is going, looking at your hospitals and your capacity there is important. How do you know when the policies are too strong? If you can't get the economic output to generate revenue and sustain subsidies if they're needed or other efforts, then it's obviously going to be too much. And so this is the other side of the coin that people are trying to balance. And like I said, you can there's of course damaging effects on health and other elements, but essentially you're finding where you are as from a policy perspective on this kind of issue. Next slide. How do you respond to this situation? If you're a society that's looking to have some balance and be able to be responsive, that you need a lot of information to do it. And what's been really I think interesting from an economic perspective is when you provide information to people, they're making changes in their behavior prior to policy changes in many cases. So people see the case counts, they talk about it in the news, they can tell if it's a national story, if it's actually hitting Oregon or their county area, and so. The idea of using information to help have a more dynamic response has clearly been pretty effective, and I think is good because it has the potential to be more optimal. You also want to provide information about who's at risk. That's a part of your shielding strategy. Certainly, I think most people have a good idea if they are at risk. They may be choosing to accept that risk, but the information's been pretty clear on that from the beginning. And so those are important elements. And then policy sophistication. We started off with a stay home campaign that was statewide. It was probably not necessary to do it statewide when you looked at the trends in various counties, but we moved towards a policy apparatus that could be more sophisticated and modify the policies in different areas. That's clearly the better situation. Each of the counties and regions are on a different path, and you need to respond differently. So for the most part, the policy, there's been a few times when a county had to have a special set of rules in Oregon, but for the most part, mask wearing made a big difference, and physical distancing. People are responding in that way, and that usually has been proven. Next slide. One of the things, going back to the idea of balance, the virus really wants to accelerate quickly. And so here's the case counts over time. And, there's this concept of R naught or the natural speed of the virus. And the point here is to show that when the virus wants to start get going, it goes up pretty quick. And so you don't have the luxury of a lot of time in trying to respond. The other issue is that when you're thinking as a society of what level we can tolerate, a high level or a low level are equally difficult to maintain. So in either case, you need to if you want to maintain this at a certain level, it doesn't matter if it's high or low, you're going to have to do the same actions. And so that would kind of suggest that a lower level it's no easier to maintain a high level than it is to maintain a low level, I think is the point. And this is basically the math of how exponential growth works. Next slide. This has been an interesting comparison of the international comparison of various countries. And I think this helps give a little, we think in the US of the situation here, but thinking to other countries, what you see on this graph is the deaths per million on the x-axis and the GDP loss on the y-axis. And so upper right is the best performing countries in terms of lowest number of deaths and lowest level of GDP loss. And what you can see is, indeed, you know, there are countries that have been quite poor in this. Peru, actually Belgium, Spain, UK. The US is performing about in the middle when you look at this, but the true top performers here are South Korea and actually China, if you believe their data. A few other countries. So it's worth kind of recognizing that I don't see any relationship between if you let this run, your economy does better. And this data is kind of showing that between countries. And, you know, there's also kind of the interesting comparison of the United States and Sweden, which is we're actually performing very similar to Sweden. And I know a lot of people are thinking of that as a different strategy. By these data, it looks quite similar. Next slide. This is just a quick slide to kind of show the trends in the hospital. Remember, I mentioned the hospitalizations are, I think, the key metric, even more so than cases, because this represents how close we are to our capacity. And you can see the regions were actually quite different and kind of on their own paths, and they've consolidated a little bit and starting to follow a similar track of recent. None of them are quite a bit higher, or much higher than the others in terms of the number of patients per 100,000 in their area. And so I think that's interesting and is a good way to kind of understand what's going on around the state. Next slide. In order to produce a forecast, one of the things that we look at is some leading indicators or things that we hope are leading indicators. What I'm showing you here are three key metrics: the social distance index, the mobility and engagement index, and the device exposure index. Each one measures things a little bit differently, all based on looking at anonymized cell phone data. And one is looking at, are you moving around? That's both the social distance index and the mobility engagement index. But then the device exposure index is even a little bit more interesting, which is it's how close together are devices. It can actually see, hey, there's a lot of devices in a facility with square footage. Odds are very difficult to keep your distance in those situations. It does not know if you're wearing a mask, of course. So what you can see is all those indices went up prior to our second wave, which occurred kind of end of April, going into May and June. Now, right now, I'm tracking these to see if I see them go up to predict the transmission rate. And so far, I haven't seen them increasing in the latest wave. And so the transmissions are occurring despite these metrics not being as good of a leading indicator as before. Next slide. So this is a forecast slide, probably what you were really waiting for. And essentially what I do here is I'm measuring how effective our policy are at reducing the transmission rate. A high score means we're very good at decreasing transmission. A low score means we're letting it slip. And so as you can see, this goes up very quickly to during the stay home campaign and soon after to 83%. That means we were very effective at stopping transmission, but it's been going up and down in waves since then. And those waves are not just unique to us. In fact, I've studied all the counties in the US, and in almost every area experiencing similar waves like this. The magnitudes can vary, but so what I'm showing you here is that we're kind of coming to the bottom of hopefully the period where we're being lax, the end of the orange dots. And then as we move into the red dots, we expect to see a tightening or kind of our response to slowing this down. And as long as the policy is below the black line, we still have growth, but it's a slowing growth as that effectiveness goes up. You can see I have a down point for Thanksgiving. We know that we're expecting transmissions to increase as people probably take additional risks during that time. So if you kind of believe this story of what has happened and what we're projecting going forward, the red dots, the forecast of the hospital census will be, next slide, will look like this. So the black line into the future is where we think things are going if we perform as we did in that last set of slides. And so as you can see, we've kind of had a little bit of a false summit just recently, maybe related to Labor Day, low wave there, or shadow. But we still think this wave is going to go up a bit further. We're probably going to get above our previous high points for hospital census before it starts coming down again. And that's what this forecast shows. And let's see, it looks like I'm about at time, so I want to give time for questions on this to the board. Any questions about these slides?
Ms. Tyson?
Thank you, Dr. Gray, for information, very helpful. And also I appreciate you being a resource for Oregon about this pandemic. So my question goes back to one of your early slides regarding the kind of recovery by income. High income and middle income people kind of back to normal, where people that are on the lower end of the spectrum are really struggling still. Can you give us an idea about the percentage of the population that represents in Oregon? I'm guessing that it's a fairly big percentage.
You know, I don't have the percentage off the top of my head, and so I wish I could produce that for you. In general, I believe the slide was like under $15 or $20 an hour was the low wage, which is slightly below the median. So I'm going to guess it's around 30 or 40% are going to be in the low wage category. In terms of, yeah, the impacts, the other slides that go along with that is this is the leisure and hospitality sector that's been most. And so there's going to be low wage workers in that area. What else do we know? Oregon's not performing much worse than other states. So all in general in the leisure and hospitality, but for some reason our low wage workers are performing worse than other states. So, you know, I don't know the full story there. I'm not the employment economist on this, but definitely concerning data on that.
Thank you.
Mr. Zika?
Yeah, thank you for the information. I'm a data geek and I really like this stuff. And it seems unfortunate to me when I see media reports from around the world, in the United States, they never cover the deep consequences and the balance stuff that you talk about. And the fact that everybody is so negative, it just seems like, you know, when you look at the data, it's not as bad, certainly when concerned. And when you see as Amy mentioned, on the low income side, and you see people that are vulnerable, there's a lot of work still to go and everything else, but it just is frustrating. There was a comment last Friday from a senior advisor at OHA saying, geez, it looks like we could be out of hospital capacity by December 1st. And I see comments like that, and I'm like, is that just a scare tactic that folks who are policy people have to put out there to keep people from, you know, dealing with this fatigue and not wanting to wear masks? I mean, it seems like we know that the masks and the distancing work, and if we just stick with that and then try and help with the vulnerable, you know, that's kind of the answer. But anyway, I mean, it just frustrates me that we don't have it's either we're failing or we're doing great. It's never kind of a balance with some data that helps that. Do you get requests from the media for more of this detail?
Yeah, I mean, I think, yeah, people are, you know, whenever I send out this data, people are really interested in the patterns. I think just, I mean, your point of seeing the waves and seeing it go up and down, I think that is what people are responding to, is things do get better. And when it starts getting better, everyone, you know, your instinct is to be worried about it coming back. And it has done that. And so I think it's pretty natural for us to kind of follow a wave. Ideally, this wave doesn't keep trending upwards. We want this to oscillate around something that is truly manageable. And ideally, you get it to a very fine-tuned policy that hits the metrics that people are comfortable with. I think you're right that there's consequences, and so you need to have both sides of this. You're weighing the two big concepts in life, right? Death and all our productive ability at once. And so to hit that just right is hard. And because this virus likes to accelerate, you think you're there, and then it can get away from you pretty quickly.
I think I saw your trend line. Well, I know your trend line addressed Thanksgiving and people getting together there. And maybe I missed it. Did you talk about the impending cold weather, and what that may do to the number of cases?
Yeah, that's been part of what's kind of overlapping with our increase right now. So some of that began with schedule changes in just people's lives during fall. You get new exposures in September and October, and then the weather changes are really problematic because most of the way we've been able to maintain our social distance, even some of our economic output in terms of eating outdoors and whatnot, is through being outdoors. And so it is, that I would say a critical feature or thing to be watching is, can people effectively go back to a situation where they're not, where they're able to engage without being indoors with each other?
Yeah, and I guess if we go back to the economics of it, the outdoor dining, and like you were saying, the lower wage earners in the leisure and restaurant industry were impacted hard, but people were dining outdoors. Then if the weather changes and that goes away, it could be even worse in that community or that group.
Yeah, I'm not, I don't own a restaurant, and I don't know, but it seems like it's going to be very difficult.
Okay, I don't see other questions from the board members in the chat, so I want to thank you for the time. Apologies that we were a little early, but thank you for adjusting and joining us a little bit early. So thank you for that.
All right.
Okay, I think we'll transition to Drs. DeVivier and Hunter for an update on the work and the efforts in the organization to get to an anti-racist organization and have a culture of inclusion. So I'll turn it over to Dr. DeVivier and Dr. Hunter.
Chair Monfries, thank you very much. It's a real pleasure to be able to talk about something that we're passionate about and that we've been working hard on since the town hall in July, and really also great to work with a partner like Dr. DeVivier in leading these efforts and tying all our OHSU health efforts into the institutional university efforts that he leads with Dr. Jacobs. So I'm going to ask Dr. Jacobs to Dr. DeVivier to start with his comments, and I'll talk after that about a few specific things we're doing in the health system. So Derek, thank you.
Thank you, Dr. Hunter. Good morning, and thank you for the opportunity to an additional update on diversity efforts at OHSU. If I could have the first slide, please. This slide serves to remind us and center us on the journey that we are undertaking as an organization to become a multicultural and anti-racist organization. It's a reminder that this is a continuum, and as with any continuum, change is most apparent at the extremes, and movement between the extremes may be subtle and sometimes imperceptible, but in the grand picture, movement is occurring. Next slide, please. This slide once again centers us on our commitment to continue with the work of implicit bias education and dismantling structural racism, which are, as the diagram shows, interconnected, and consequently our work moving forward will represent a multi-pronged diversity effort. Next slide, please. And this slide centers us on our commitment to work, to continue our work and the different realms that we are working in which our diversity and anti-racism efforts are continuing to move. Reminds us to continue to support this work at the individual level, as well as at the systemic or institutional and structural levels, and of course, at the area of the intersectionality between these realms, and that would be the interpersonal. Next slide, please. So we will be moving forward in this presentation to discuss and utilize our unconscious bias training dashboard. This is our first report out on this, utilizing this dashboard. And it will help us develop expectations, which will be done in consultation with stakeholders across OHSU. It is a starting point. We will continue to refine this dashboard as we're moving forward. The data in the dashboard will also allow us to better allocate our DEI resources with regard to education and training across the institution. There's today we'll see data for frontline workers in healthcare delivery, and these categories include APPs, which are, for example, PAs, nurse anesthetists, and nurse practitioners, physicians as defined by those with an appointment in the practice plan, and nurses as defined by an O&A designation. We are working on further refining our categories and expanding them. And in doing so, we will be faced with challenges due to organizational title and classification. Lastly, the slides represent data from earlier in the week, but this data is updated and available daily. And as such, we can really get some real-time information as we're moving forward. Next slide, please. So this first slide here focuses on our APP designation. As I said, that this is for example, nurse practitioners, PAs, nurse anesthetists. Notice in the upper left-hand corner, we have an employee count of 502. Following below that, completed rate of 27 or approximately 28%. Of those that are have not completed at this point, we have a registration rate of about 3.7%, and that really reflects a not registered rate of about 68%. So we can see here that there's definitely, we can put more resources to communicating and driving registration. And we need to improve, obviously, our completion rate. So this is a fantastic example, once again, of where we can see our deficits are and start to direct our resources. Next slide, please. This just shows the distribution for the UCBI and training and location of our APP folks, whether they have a faculty designation or unclassified admin research. Really, if you go, and I'm talking in the upper left-hand corner, if you go to the bottom left-hand corner, you see that the research and unclassified admin, the numbers are really low. So it's really kind of noise in the data. We see the faculty designation is really where our numbers lie. Next slide, please. And this is the geographical distribution across OHSU with respect to this job classification. If you look at the upper right quadrant, you'll see that really our numbers are really focused on Hill in Portland. So once again, really telling us where we can direct our resources to get to really impact training. Next slide, please. This is our O&A distribution. You see our employee count is 2,854. Relative to other groups, we have a high completion rate of training of about 50%. Which still leaves another unregistered portion of about 50%. And of that, the portion that has not been trained, we only have about 1.3%. So we really need to increase our efforts of driving registration. Once again, demonstrating where we can put our resources and leverage our relationships. Next slide, please. This slide really is, the numbers are pretty scrunched up here, especially if you look off to the right side with hiring managers and the additional completed non-supervisor. Most of that would be unclassified admin, so the numbers are really skewed on the far right side. But once again, it really, the columns on the left really reflect the registration rate at 40, about 50%, or completion rate at about 50%. So redoubles where we need to put our efforts. Next slide, please. And then once again, if you look up at the upper right side, we see that the vast, and as expected, the vast number of members of O&A are going to be concentrated on the Hill. Next slide, please. And lastly, this is our slide for OPP, for our physician designation. See that we have a count of about 1434. Of those, a supervisory count of 275. The completed rate is about 30%. So we have an uncompleted rate of about 70% in the physician OPP designation. Of that, we have less than 0.5% who are registered for unconscious bias training. Really shows where we need to redouble our efforts to reach out and work at registering physician faculty with that OPP designation to be involved in unconscious bias training. In addition, if you look off to the right side, you'll see that we really need to also impact unconscious bias training for hiring managers and search committees with that OPP designation. Next slide, please. Just another slice of the data here, just reinforcing the previous assessment. If in the lower left-hand corner, absolute numbers showing that faculty cut of the data. Next slide, please. And as with the geographic location, really showing that across OHSU, we really have to double our efforts on the Hill. Next slide, please. With regard to an educational program update.
So before we move off of that, I for just state, I mean, I think when we talked about this a couple of years ago, we were rolling out unconscious bias training. The two areas that, you know, as a board, we mentioned, or at least I mentioned as critical, I think, are the hiring managers, as well as not just the physicians, but all the frontline workers, right? We just, at the top of the meeting, we commended Dr. Jacobs on his article about bias in healthcare and trying to get equity there. And so it's important, I think, that we start with training the frontline workers to ensure that as an institution, we are not biased in our caregiving. And it's not a charge to anyone, but I think those frontline workers, as we all know, are working hard. They're taxed and easily can say, "I don't have time to do this because I'm busy." And we're in a pandemic, so all of those things come together, and then they don't take the training. And what we don't want to do is be seen as not pushing this training on those important workers that are the face of the institute to the public in terms of our caregiving. So it's really important to me and I think some other board members that we get those efforts to get them through this training and do it as quickly as we can, because we've been talking about it for a while.
Completely agree. I think that with this rethinking how we deliver the curriculum is also going to be an important component given the time constraints that you outline with the delivery of care. So one of the tasks that we will have to look at is how we can change the curriculum, or more so the delivery of the curriculum, to maybe an asynchronous format, while not cannibalizing numbers from the more enriched in-person programming or curriculum that we have. I think that's an important aspect there. But the data definitely shows us where the need is, as well as with search committees and our need to diversify our workforce also.
Thank you.
Any other questions, or I can move forward?
Mr. Dubé.
I can go forward.
Prashant has a question.
Oh, okay.
Sorry. And sorry, I'm wearing a mask because there's actually a contractor in the house while I'm doing this. So hopefully you guys can hear me. I'm being safe. Just want everybody to know. So Derek, great to see you, by the way, and fantastic work. You know, I guess that anti-racism as a concept in the continuum is relatively new as it's articulated in society overall. So, I mean, are there any, when I looked at the continuum over and over, it's hard, as you said, in the middle to determine the distinctions between different sections. I mean, the ends are easier to understand to a certain extent. But is there any evidence out there as to how long it takes for somebody to move towards the continuum? Efforts are, all the training initiatives are fantastic, but I mean, this is a long-term thing, right?
No, I think you're hitting the nail on the head, and what the assumptions that your statement's grounded in are that this is a journey, and the proper way to look at this is as a long-term journey, that improvements come as we move forward, which is really the essence of that continuum. So progress is really where we need to hang our hat and not get too caught up on the fact that we that there's an end goal that we're going to achieve in 3 years, or there's a 5-year plan or a 7-year plan. At the end of 7 years, we'll be an anti-racist organization. This is a day-to-day, long-term program. I think one of the best ways to look at this is very much like in clinical, the clinical mission, we have continuous quality improvement, a CQI, which is continuous improvement over a long term. We look at this as a CDI as a continuous diversity improvement or continuous equity improvement. That is a continuous program. So building the infrastructure to continue that journey is really where the goal is centered.
Yeah, I appreciate those comments. That's why I continue to talk about it as a culture, right? We have to develop a culture there. So thank you for that. I believe Ms. Khan had a question and a comment.
Thank you, Mr. Monteris, and thank you, Dr. DeVivia, for sharing. I think I mentioned this last time a little bit as well. I think we have to be careful when we extrapolate this data, particularly as far as, the number of people who've completed the training versus not, and how we give out resources for that, because it's not a one-to-one. The number of people who've completed the training does not necessarily make them anti-racist versus, and obviously it's all on a continuum. So one of my questions to follow up on that is, if, say, for instance, we do reach that mark that it's 100%, everybody has completed the training, where do we stand then? I guess would be my question, because right now we're getting to that point. But when we get to that point, what does that mean?
Sure. So I guess just a couple of clarifications here. With my use of the term of resources, does not necessarily mean just financial resources, right? It would be, manpower, effort, how we develop programs, such as I was speaking in terms of Wayne Monfrey's highlight of the efforts that need to be put into servicing the needs of clinical staff, so changing curriculum or delivery mode. I think the Unconscious Bias Foundation's training is just that. It's a foundational training. It is not going into that continuous diversity improvement paradigm. It is not the end goal. As I had mentioned, this is for lack of a better example, this is really a demonstration of our data gathering ability and the structure that we're creating as we continue with other educational curriculum. So furthering our anti-racism curriculum, furthering, for instance, our Stepping In program that the School of Medicine is bringing into the university, and the CDI is going to be assisting with distributing across the university, or active bystander training, or other work that we're doing in anti-racism work. For instance, the search advocate training to expand the diversity of our workplace. So it's going to be a continuous process with continuous efforts, understanding that it's a journey.
Okay, thank you. Ms. Tyson?
Yes, thank you. I think I would like to expand a little bit more on Ms. Khan's comment. I think that so many institutions are doing this kind of really good work, but there's many components to it, not just the DEI completion, et cetera, but all these metrics that go across the institution at OHSU, and how are we setting up that dashboard, if you will, to measure the progress? What are the areas that we choose to measure? And perhaps some of that will come out of the study group that Dr. Jacobs mentioned at the beginning of the session today, with regards to many stakeholders participating and defining the kind of work and how we want to move forward. But one of the things I do feel pretty strongly about, particularly in Oregon, because we have, a troubled past, if you will, as a state, is how do we not just attract, but how do we support and retain our work with regards to a diverse workplace? And I'm hoping that the efforts that you're working on, Dr. DeVivier, has to do with those kinds of components that we can plug in to be sure that the individuals that we attract, that we are able to retain them and they can continue to excel and contribute to the institution over the long term.
Yes, absolutely. This data that I'm reporting out on is really just foundational data. There will have to be efforts across the university, as you're pointing out, for recruitment and retention across the university, across the different missions. That will be extremely important. Another aspect of this will be, as a healthcare institution, how are we addressing health disparities? How are we looking at health equity, and how we bridge that with the needs of our communities and the traditionally marginalized communities in the state of Oregon? Those are all large picture aspects that we're going to have to address. We're going to start to follow. There is work that's being done right now across the university to look at those efforts and to begin those efforts. And it's my intention to be able to organize and categorize those efforts to bring back to this board at a later time.
Great. Ms. Chamberlain?
Thank you. Along the same lines, I know it's really, thank you for putting this work together. And I know that getting sort of this foundational training in place is really important, and measuring that is really important too. But sorry, those are my dogs. But moving forward, how do we measure the actual impact of that training to really see whether or not it's helping change the culture of OHSU? And then also, how are we working with impacted employee groups at OHSU to get their input and their, not buy-in, but ownership in the program as we move forward?
So a couple of points there. You're you're correct about the need for metrics. We are, for instance, with the stepping in anti-racism training, there is the ability to do pre-assessment and post-assessment after the training. At a larger institutional level, there is obviously surveys that will need to be done to look at organizational engagement and the impact of the anti-racism work that will need to be done. There are other metrics, for instance, with in the healthcare arm, looking at the outcomes for health equity and how we are. What our numbers are in terms of health disparities and how we're impacting health disparities. I also think that you bring up a really important point. That's the need to have shared a sharing of this work and an empowerment of the marginalized communities that this information or that this work impacts. Right? That is an extremely important point, is being able to empower folks and to make sure that the outcomes are equitable outcomes and they're not driven by those who are sitting at higher levels of power.
Great, thanks. Before we go to the educational program, Dr. Jacobs had a few comments. I want to give him a chance to state them to the group.
Yes, thank you. Great conversation. So wanted to highlight a couple of things that I think is coming out in the discussion. First is with Dr. Duvivier's leadership, we are simultaneously looking around the country to identify what should be done after we complete unconscious bias training. Most folks consider unconscious bias training to be foundational, but it really is important when we're doing that to think about what comes next. Now, one of the benefits of the reporting system that Dr. Duvivier has developed is that it provides a framework or a system that can be used to track other important data. On that second slide, I think Dr. Duvivier presented, it talked about that continuum towards being anti-racist. You'll see in that framework that it speaks to the importance of having data systems for recording and tracking, et cetera. And so this is going to be partnered with other efforts to actually, to Ms. Chamberlain's question, to actually look at its actual impact on things like how diverse our populations are in the various employee groups. And so I think it really is going to help us be more targeted in the actions that we need to take. This slide here actually speaks to some of the other things that are critically important, which are just part of that whole framework that Dr. Duvivier outlined as a continuous quality improvement effort. Thank you.
Thank you. We'll let you push forward on the educational program update. Thank you.
There is a comment in the chat box. Ms. Tyson, I'm assuming that we aren't waiting until the unconscious bias training is completed before we set and begin implementing next steps. No, we are not doing things in a serial fashion. We're working in a parallel fashion. And I think it's a great segue into the educational program update. And you'll see that things that we have coming along would be the inclusive language guide. We have an inclusive language guide that multiple stakeholders across the organization are working on. It will be a first edition that will be debuting, coming out probably sometime the beginning of December. We have a program called StoryShare. StoryShare, it's a podcast of the experiences of faculty, staff, and students from marginalized communities. It will be accompanied by a self-reflective toolkit that will debut in 2 weeks. The second installment is in production, and the third is in the planning stages. This is a really important aspect of anti-racism work because part of anti-racism work is a healing process, and that healing process is grounded in the sharing of stories and the development or the reinforcement of empathy. And so this is a organically grown program here at OHSU that's growing out of OHSU culture and represents members of the community. We have the Stepping In program, which is an anti-racism training program that has qualities or elements of social justice and restorative justice. It's also grounded in the theater of the oppressed as a curriculum delivering tool. We're having our Train the Trainer session beginning November, December, with expectation of rollout the end of January. We also have a search advocate training program that is underway that will follow pretty much the same timeline as the Stepping In training. So once again, we're not just putting all of our efforts into the unconscious bias training. As I had referenced in the very beginning, this is going to be a multi-pronged diversity effort. Next slide, please. And we have numerous policy updates that are occurring across the university. These are not necessarily centered within the CDI, but CDI resources are helping to inform the process. All of these policy review updates, all of the policy reviews that are occurring have multiple stakeholders involved in the process, and there will be a number of iterations that will have all stakeholders be able to give more and more input. So there's a code of conduct review that is ongoing. As I said, multiple stakeholders are involved. Crisis care guidelines. This is highly nationally, this is something that has been in the news with concerns about structural racism in the crisis care guidelines, specifically with the allocation of scarce resources. We're taking this very seriously and have an ethics review panel that is weighing in on our crisis care guidelines with a structural racism lens. We have an ethics review panel that is working to review our policy on the ability of a patient to select a provider. In addition, we're looking at the impact that racist patients can have in the delivery of care and how we deal with the racist or the disruptive patient. I have listed a fantastic journal article here out of the Journal of Ethics for the American Medical Association. This is a very big topic right now nationally, and this journal article really touches it well. We're, as Dr. Jacobs have said, we're reaching out nationally and collaborating with other institutions to try and find best practices. This is the perfect example to that end. We are participating in a national discussion on this specific topic at Penn State, and we have already reached out to Albert Einstein University and have had discussions at their highest level about best practices. Next slide, please. And I just want to leave in this discussion with this slide, really shows a difference between equality and equity. And really what we're aiming here is the elimination of the fence and really trying to empower individuals. Anything I can end here, and we can either entertain questions, or I'm happy to pass this off to Dr. Hunter.
Dr. Jacobs.
Yes, thank you. And so I hope it's apparent that that we're thinking about this, as Dr. Duvivier said, there's a number of things that need to happen in parallel and in a collinear fashion, which means that you should continue to expect to see actions we take immediately that I think will benefit the institution and all of our members, while we also put those steps into place that affect the quality of our institution as regards these issues of anti-racism, structural racism going forward.
Thank you. No other comments or questions, so I guess we can go to Dr. Hunter.
Thank you.
Thank you.
Thank you. If we could move to the next slide. I have my eye on the clock and realize that we have about 8 minutes left to cover what we're doing at OHSU Health. We have, of course, sent the slides out. You'll have a chance to go through those. And Mr. Monfries, should you so desire, I'm happy to spend some more time at a future meeting on some of these, or we can just leave it with the slide set. But this has been a great conversation, and every minute has been worth it. I was reminded of Dr. Jacobs' sort of African proverb when Derek started talking about the long-term journey that we're on. That is that if you want to go fast, go alone. If you want to go far, go together. And my concern, while we need to go fast and get ahead, is that we also need to bring the troops up. We need to fill in and make sure every individual working at OHSU has the opportunity for unconscious bias training and these other anti-racism initiatives. So the data is very helpful in getting us along the journey. So if we could have the next slide. Next slide. Next slide, please. So these 6 initiatives were laid out at the town hall on July 21st. And I'm going to go through them quickly one by one so you don't have to read them now. Next slide. The first, which I think was probably the most important of all of those, is asking Derek to help us in the health system management team guide diversity, equity, inclusion, the DEI work, and anti-racism efforts across OHSU Health. and you've already heard the many ways she's doing that. Next slide. The education, again, you've heard much of the education and where we are. The bystander training courses have been in place for several years, but I think have been probably need some emphasis and some promotion because I think they're extraordinarily valuable. The stepping in and a homegrown module will be 2 anti-racism modules as follow-ons that are in process. And then you've heard of the tracking tool. Next slide. I think Mr. Monfries spoke very succinctly about the need to change our culture. And I think if there's one thing where I think we really need to sort of spend as much energy and resources as possible, it's in this area. I've been wanting for some time, and I think getting some traction on adding a senior high-profile role in HR to support DEI and underrepresented minority recruitment, retention, and representation on our workforce. Through the years that I've been involved with this work, first with Dr. Gibbs and now with Dr. DeVivier, it's become clear to me that members of our workforce need representation and need support. I think Dr. Jacobs has brought in some consultants to help with focused reviews of hotspots, and those reviews, the first of those have been returned, and we'll be acting on that. And then the additional training and accountability for managers. My comment there is that while DEI work is all of our work, and not just the work of HR, not just the work of the senior high-profile individual. Next slide. So access to COVID testing is one of the areas where we have worked hard to provide that to underrepresented minorities through our community testing sites. Also working very closely with Salud, which is a program designed to bring health and health care to workers in the wine industry, most of whom are Latinx. And it's done in collaboration with Hillsborough Medical Center. And just yesterday, we brought our integrated delivery system into the mix to help support Salud in their caregiving. So there is a study ongoing with the Self-Enhancement Institute that is being championed by Donna Hansel to identify outbreaks of COVID in disadvantaged communities. And then we are been asked by OHA to provide further outreach testing, perhaps through the use of mobile vans and other means to get to communities that were otherwise underserved. Next slide. The last 3 that I'm going to talk about very quickly, again, noticing the time, is a program to enhance awareness, amplification, and philanthropy in social determinants of health and health equity and anti-racism. And we started yesterday with what I thought was a great program. Thank you, Dr. Jacobs, for leading it off, and Dr. DeVivier for moderating it, called "What is Health Equity and Why is it Important?" And this will go on through a monthly noontime symposia reflecting programs that bridge OHSU and community partners. Next slide. Coupled with that, next slide, yeah, we will tie these efforts to the need for OHSU to get into the community, to better tie our public health efforts to the community efforts. And we will start by listening and working with the foundation. We will build a platform from which we can understand what the community needs to develop community partnerships and relationships that are based on power sharing and alignment. And my last slide, if you could move one more, is a new one which has been identified by our team. And I would point out as you look through the rest of the slides that there are just a lot of grassroots efforts that are bubbling up that have informed us on how to move forward. and the efforts that Dr. DeVivier was talking about on how to deal with a racist patient has sort of has a part of that, which is the interest and responsibility to protect our workforce, to provide a safe and equitable workplace. The Code of Conduct revision is one of those efforts, and then re-examine of our policy requiring staff to care for abusive patients is another one of the efforts in this area. So I will close there, going this at the top of the hour, allow you to look through the rest of the slides. There's a number of slides about a data initiative, which I think is going to be fundamental to us understanding our patients and how better to serve them by understanding the race, ethnicity, language, and disability status. So with that, I appreciate the opportunity to present and would entertain any questions if there were any, but I recognize that it's already noon. Thank you.
Well, I mean, so thank you both for that, and I appreciate the update on the initiatives. I appreciate materials that we have with the grassroots initiatives as well, and don't want to give it short time, so we do have a few minutes. I haven't seen any questions come in. With that, I'll just ask if there's anything in these grassroots initiatives that you've identified that you want to call out before we close.
Sure. If you could go to the, thank you very much, Chair Monfries. If you could go to the next slide, I'll just point out two things here. One is the professional and support services that has really kind of taken this to heart and spends a great deal of time thinking about this. And you can read through the slide the many different ways in which they're manifesting anti-racism in all their activities. And next slide. And then one other I'll just show and then maybe stop here, which is a interdepartmental or intradepartmental message board that was shared to promote wellness during a time of the early Portland demonstrations and around the killing of George Floyd, and how the emotion and passion and distress that was felt was shared with this message board within radiology, and it was, I think, a very helpful way for people to connect in a time when they couldn't be face to face and to share stories. So maybe I'll leave it with those two, but there are quite a number of other examples that we could bring forth.
Thank you, Dr. Hunter. I think as you and Dr. DeVivier have mentioned, I think the idea of all of this is we spend a lot of time on the training, but it is a journey to develop a culture, and things like the message board and the other areas that we're working in, the support for our professional and support services is critical in creating that culture of support, that culture that people are cared for from the institution, and that we realize that everybody faces a challenge, because everybody has diversity challenges, and what we want to do is get to that inclusion, right? I think in Dr. DeVivier's slide, where we have equality and it shows a picture, and we have equity and shows a picture, but ultimately inclusion brings empowerment where everybody feels their voices are heard. So I look forward to continuing to work with all of you on driving this. As we've said, we'll continue to keep this as an item that the board gets updated on, because we want to make sure that it is front and center as we go down this journey of changing the culture so that everyone feels included. So thank you all for this time. With that, seeing no other questions, I'm going to adjourn the public portion of the meeting. We're at 12:04, 12:05. We will take a 5-minute break. I believe that from a technical perspective, we will unplug from here, and then we will reboot to join the private meeting. Thank you all for joining, and look forward to speaking with you again at the next meeting.